All right, we have the city manager's report tonight, and no surprise here, we are going to hear about COVID-19. So I'm turning it over to the city manager, who I know is going to.
Thank you, Mayor. We have some representatives from both City of Asheville Fire Department as well as from the County Public Health Office. But before we start, I just wanted to just make a couple of comments in terms of maybe an expression of gratitude for the amount of collaboration and coordination that I think is happening. I've been here a year, and I've heard that didn't happen a couple of years ago. So I'm so glad and want to commend the county manager, Avra Pender, for the work that she is doing to ensure that there's a heightened level of collaboration and information that's given out to the community. So with that, I will ask our representative from the Asheville Fire Department and the county to come up and provide you with some extremely important information. This presentation will not answer all the questions about this unfortunate situation that we have in our country and, quite frankly, globally. But what we hope we will do is to provide you with, when you do have questions, there are sources that you can go to, may not give you complete responses, but will provide you, hopefully, with enough information to make good decisions about your health and your family's health, and more importantly, or equally as importantly, your neighbor's health. So with that.
Thank you, ma'am. Barry Hendren, Assistant Fire Chief, Asheville Fire Department, Mayor, Council. It's our pleasure to try to update you a little bit about the COVID-19 outbreak that's currently affecting our nation and the world. Just very briefly, the first and foremost is Ms. Campbell mentioned Buncombe County Public Health is the lead agency in this event. They are doing a phenomenal job in preparation and will lead the response to the outbreak in our community if and when it does occur. Some information that has just occurred. The state of North Carolina has declared a state of emergency to assist with the response and preparation efforts for local governments. That will really aid us in a number of areas that, as it relates to accessing response or resources from the state and federal level. Also will assist with some messaging to better prepare the community, and also will help with some of the supply chain issues that the medical community is currently experiencing. Right now, there are 7 confirmed cases in North Carolina. There have not been any confirmed cases in Western North Carolina. There is 1 confirmed case in Spartanburg. That's the closest one that has been noted right now to us. I think the state of South Carolina has 7 cases as well. We are still really focusing on prevention and preparation for our community. I feel like that is what we need to do to help our community be prepared and withstand an outbreak if it does occur. Risk within the community as a whole remains low. There obviously are some high-risk populations within our community, but overall our community risk is low. And getting accurate information to the community is our priority. And again, I want to speak very highly of what Buncombe County Public Health, Buncombe County Emergency Management has been doing in collaborating with us and other municipalities and parts of local government. Call up Fletcher Tove. He is the lead for the EPI team from Buncombe County Public Health. He and Dr. Mullendore have some more information. Dr. Mullendore, you want to start?
So I'm Jenny Mullendore. I'm the medical director for Buncombe County Health and Human Services, and soon to be the interim health director as well.
Get a little closer to that microphone. There you go.
Thank you. So Jennifer Mullendore, medical director for Buncombe County Health and Human Services. So we've been communicating with a wide swath of partners, including healthcare providers, healthcare facilities like long-term care facilities, adult care homes, school systems, and private and charter schools, employers, conveners of mass gatherings over the past several weeks, pushing out CDC and state guidance so that they are taking preparedness steps to help prevent infection in our community and then also be prepared to respond. What I would like to say again is that we do not have any confirmed cases in Buncombe County at this time. We are working closely with, again, healthcare providers to identify people who might be at risk, who might need testing, and then working with our emergency services to make sure that we can respond appropriately, working with Mission Health and other local hospital systems so that we're ready to respond if needed. What I would like to convey to the public is that if you are worried that you yourself have COVID-19, do not show up to the emergency department. Do not show up to your doctor's office. Pick up the phone, call your medical provider. If you don't have a medical provider, call us at Buncombe County Health and Human Services Communicable Disease, and we'll talk it out with you, determine if you meet criteria for testing, and then work that out. We don't want to potentially expose people unnecessarily. And in terms of the emergency order that came down from the governor today, the guidance was, again, focused on high-risk persons. And so statewide, the recommendation now is that people at high risk, this is people who are over 65, who have underlying health conditions, so any sort of chronic medical condition, or a weak immune system, really need to avoid large gatherings of people at this point. And so that would be things from concerts, conventions, church services even. And so again, we're pushing that messaging out to those conveners of those events, but also want the public to be aware that they need to take action to protect themselves. And so we would just encourage people to read that press release. We're trying to get it pushed out. And if they have questions, Fletch is going to talk about some ways that they can reach out to us in public health.
Good evening. Thanks again for having us here. I'm Fletcher Tove, the Public Health Emergency Preparedness Coordinator. So I want to just make the point real quickly that this is a constantly evolving situation. So the guidance we have today could very well change later today or tomorrow. But to adapt to that evolving situation, we've taken a couple steps. First, we have a county standing epidemiology team. For the last month, we've moved that to a weekly operational cycle to keep up with the pace of events and information coming down from CDC and the State Department of Health and Human Services. We've also greatly expanded participation in that epidemiology team to include county municipalities such as Black Mountain and Woodfin, reaching out to all the hospitals, both city and county school systems, the airport. So we have a much larger epi team than usual to address this threat. So we have that room convened every week. We've got over 1,000 years of experience in public health and emergency preparedness in school and government administration. We also, on Monday, established a joint information center, and this is not a traditional ICS JIC at this point, but it is based off that model. So the idea of that is throughout the county and jurisdiction, as we receive media requests or requests from the concerned public, that all comes to one joint information center, so we can address that and make sure any message going to the public has one strong, unified voice, making sure we're giving the same guidance, pointing people to the same resources, and we're not confusing people. The other thing we're doing is having a weekly press availability on Thursdays at 2:30. We're in our third iteration of that, making ourselves available with the media as partners in our preparedness efforts to get accurate information to the public. I might turn it over to Taylor, our Emergency Services Director.
So members of council, mayor, city manager, I'd like to thank y'all for allowing us here to speak to this. So I've been here for a little over a month in the Emergency Services Director's position, and during that month, I've seen phenomenal cooperation. and unity in our community as far as the service that we're providing to our citizens. I want to thank Chief Hendren and Chief Burnett for the warm welcome and all the cooperation that they've given us through some of the snow preparedness that we've had with closures, and also as we face the coronavirus crisis. So the key to this in our response is actually pulling together all of the county in a workforce that is all prepared and all in to serve our citizens better. And so I've seen phenomenal cooperation, coordination, critical thinking skills that's went into this process across all of Buncombe County. And I'm really proud to report that to you. So I think because of that, we're better prepared and we're better situated as the state, as the governor has declared this state of emergency, and the state starts to wrap up an EOC and doing it in conjunction with public health. We already pre-positioned to do that. The county has put together a strike team of folks that will work together in the planning process in the Emergency Operations Center to support public health. The city has been working with us close with that model and providing the Joint Information Center. The fire department's been working with us in responses. And we've also been looking at a response model to do what Dr. Mullendore was talking about earlier, to limit people going to the ER. So when calls come into the 911 center and we triage those calls through our calling cards, we determine folks that have signs and symptoms, manifestations, travel history, where they may be a potential exposure. And based on that, instead of sending an ambulance out, we'll send a quick response team out that will take care of those patients in their homes. And we're looking at models to continue that care so that protocols are given so that they have a standardization in care, and that care is focused on keeping them out of the hospital, and we'll do welfare checks with them to make sure that their symptoms are not getting worse, and we'll do that through phone and actually some of our response efforts. So all of that was not created in a vacuum. It was brought forward by all of our team working together so that we can decrease exposure and isolate these cases as they present one at a time, and provide enhanced care and not expose any citizens in an ER or hospital environment, and therefore expose more people. So yeah, I want to thank y'all for this opportunity, and thank y'all for supporting our team and as we move forward to protect the citizens here, and appreciate all the support that you give us during this event. Thank you.
Thank you.
Thank you, Taylor. Just to a couple more points I want to real briefly hit on as it relates to us as an organization. We are reviewing our continuity of operation plans for all departments and making sure that we have good plans in place if things do escalate. We're very focused on providing accurate and timely information to all of our staff, making sure that they have the best information that we have, and we are planning utilizing our past experiences with these kinds of events. Many of you will remember that we had the H1N1 and SARS scares over the past few years. So we're utilizing those experiences to be as prepared as we absolutely can be. And again, I just want to say it one more time, the high level of collaboration between county EM, public health has been a real strong opportunity, and has really, I think, changed the dynamic within our community for preparedness. A few resources that we highly recommend is the Buncombe County Public Health website. They're updating it almost daily. And we are utilizing their information to funnel towards our folks. North Carolina Department of Health and Human Services, CDC. Again, we encourage folks to seek credible information. There is a lot of myths still circulating, so these are some really good resources. And again, prevention is really the key. Social distancing, good hand washing, all of those things that that our parents told us when we were kids we need to be doing. With that, if there are any questions that I or the team can answer, we'll be glad to take those.
Yeah. Go ahead.
Okay. So it sounds like we've got our act together here in Buncombe County and high level of coordination. How about regionally? Is there communication happening between and among emergency response directors regionally and other departments of health? We're very well resourced here, and there are probably other counties that are not as well resourced as we are.
So you can probably answer that much better than I can as it relates to the county health departments. So please.
Yes, ma'am. I could speak to specifically the public health emergency preparedness. That's set up through a state organization, Public Health Preparedness and Response. We have, every county has a preparedness coordinator, such as myself or any county consortium. We have a regional team for Western North Carolina. We're in constant communication and meeting, sharing resources, making we're on the same page. That is something we discuss as a region. Us being, Asheville City and Buncombe County have a lot more resources sometimes. And so, sharing our resources as people reach out for them. And also looking at, as the situation progresses, combining forces, maybe making, a regional JIC to, if we get into a situation where we have this throughout the region. So we are having those discussions and sharing resources throughout the region for public health.
Thank you.
So just a couple of questions. So in terms of, I think what a lot of folks watching at home or have these questions is, what should they be doing? What should employers be doing right now? And where should they be looking in terms of the information? I know you guys talked about that website. If folks are going to be looking for kind of like one point of contact, they're going to be looking to us. We've already gotten a couple of emails. Just while you have the floor here, right, and while you've got the press here who's going to be reporting on it as well, you can just take the opportunity to say, where specifically should folks be looking? What specifically should folks be doing at this moment? And if things change, where will they find out and how will they find out?
Yes, sir. So what I'll do is I'll walk us through from a national level to local level some resources. So nationwide, cdc.gov is going to be the best resource. And if you go to cdc.gov, they have a big banner across the top for coronavirus. Moving down to the state level, the North Carolina Department of Health and Human Services also has a coronavirus page. And buncombecounty.org, and specifically buncombecounty.org/BCReady is our local preparedness site. And we're constantly updating, digesting guidance from the CDC, from the state, posting that there, giving, information. We're targeting that information as well. So we're having specific information for local business leaders, for faith groups, for schools. So we're aware of, different groups might have different messages they're trying to get across. We also encourage everybody to sign up for BC Alerts, which is a mass notification system, and you can do that by texting on your phone BC Alert to 888-777, and you should get a notification message back that you've successfully enrolled. We've also established an email account for non-medical related questions concerning COVID-19, and that is ready@buncombeready.org, READY@buncombecounty.org. And we feel that, and again, that's for non-medical related questions. Maybe businesses want to know how to prepare their staff, or family wants to know what kind of supplies to stock up on. We can field those questions there. I think those are the big resources we're pushing right now.
Okay, and so in terms of those, what, you went through that, but in terms of what folks should be doing now. So you talked about the folks who are over 65, have a pre-existing health condition. What about the rest of folks? What about kind of general employers? Should, other cities, New York is talking about getting folks to kind of telecommute and work that way. Is there anything that you all are recommending at this point, for sort of the remainder of the population and other employers who want to be prepared?
Yes, sir. And I'm going to go over first the simple steps that everyone can take to combat the spread of any influenza-like illness. It might sound repetitive at this point, but it's because they're the most fundamental things we can do and very simple. Making sure we're washing our hands routinely and thoroughly, warm water and soap for 20 seconds between your fingers, back of hands. Trying to stop touching our face, which can be difficult, especially as we're aware and realize how much we touch our face throughout the day. Using proper cough and sneeze etiquette, covering our coughs and sneezes with our elbow, or if we use a tissue, don't put that tissue back in our pocket, throw that tissue away. Increasing the frequency in which we wipe down high contact surfaces, such as door handles, phones, and things like that. We want to practice social distancing when we can. So if you have to be in a group setting, try to maintain at least 3 feet from your face and another person's face. If you can, avoid those group settings, particularly if you are in that high risk age group, to do so. Those are just fundamental steps that everyone in the community can take to combat the spread of a coronavirus. Specifically for high risk, if you looked at Governor Cooper's address today when he declared a state of emergency, he really focused on the high risk group, ages 65 and older, particularly if they have pre-existing health conditions. So really, that group needs to take an assessment of whether they're traveling or going to some kind of event, whether that be a concert, a sporting event, even a service on the weekends. Need to make assessment and individual determination, knowing the threat, so whether they don't want to expose themselves to that.
Got it. And so the final question I have, and this is less for you all and I think more for just us generally, is, I mean, you all are talking about obviously the public health impact, which is critical, and that is the primary thing we want to be focused on. The other thing that we're realizing here is this is going to have an economic impact as well, right? We're seeing that across the country. Airlines, are seeing significant bookings reduced. We're an area here that relies pretty heavily on the tourism industry. This is not necessarily for your coordination, but perhaps other thoughts here is ensuring that we're at least monitoring what's going on in terms of the economic impact for what we're seeing, not only just hit us as a city and our revenues, but just generally for the public. And I'm not sure if that's a conversation we're having with TDA or a conversation we're having with hoteliers or just generally around with employers. But if what happens here is similar to what is happening in other parts of the country, it'll have a big impact, and a lot of people's lives will be impacted in a pretty dramatic way. So I appreciate the fact that you all have come here. I appreciate the coordination. I know that's important. I will tell you, sitting here, we expect it of you. So we're thankful it's happening. We also expect it of you, and we're counting on you. We're counting you as citizens. We're counting you as elected officials. We want to put out the right information. We'll be looking to you all to do that. And when we get information, when we get requests, what I'm going to do is I'm going to send them to the Buncombe County Health Department website, what you guys talked about here, and that's where I'm going to get the information from as well. So the more you can update that, the more you can take from the CDC and from the state and put it in one place, so we're not looking at 3 different places. Get us the information we need, that folks need to know on a day-to-day basis. And we thank you. It's going to be a lot of work. We thank you all for being as well organized as you are now.
And the city's website now has a banner on the homepage directing people to the right location for information.
And this really isn't a question, just maybe to the city manager. So we've got maybe not the largest group, but a pretty large group that we're getting together. We had talked about an idea of if people didn't feel comfortable coming to a public session like this, looking at opportunities to make sure that people could still participate. Do you have any thoughts
We are
about
still working on an opportunity for you to connect with elected officials electronically, a YouTube site, or even meeting at some of our remotely at rec centers. Our challenge will be the opportunity when we have the public comment and to engage you. And that's still some details that my corporate communications director is looking at me like, what? So there are just some things that we've got to work out, but that is certainly our goal. And we want to do this even beyond this kind of state of emergency. We want to make it easier for people to be engaged with elected officials and meet them where they are. So more to work on.
Okay, thank you.
Okay, thank you all for coming tonight to update us on this.
And just in conclusion, again, thank you, and please, please, please utilize those resources Because what you heard was the most important thing about where we are is accurate and updated information. That's how we can at least manage our way through this issue. So thank you again for coming. Appreciate it.